The annual wellness visit is a yearly appointment covered by Medicare Part B for patients 65 and over. The purpose of the visit is for the patient to work with their primary care provider to create a personalized prevention plan. While this is not a head-to-toe physical, the visit does include checking height, weight, blood pressure, and other routine measurements, along with the health risk assessment and a review with your provider. The exam also includes depression screening, referrals to health education, and other preventative counseling services. Our patient access team will send an annual reminder around the patient's birthday to contact SEARCH regarding the annual wellness visit. The patient works with clinical support staff to identify if they are eligible. Once an appointment is scheduled, the Medicare Wellness Checkup and Health Risk Assessment forms are sent to the patient. The form should be completed prior to the visit and will be reviewed by the provider at the appointment. The exam begins when the patient arrives. The clinical assistant uses the Medicare Wellness Intake Form while rooming the patient and confirms they are there for their annual wellness visit. The health risk assessment is completed, the mini cognitive dementia screen is performed, and the patient is provided with a copy of advanced directive forms. Next, the Get Up and Go test is performed. The patient is instructed to stand up, walk 3 meters at a normal pace, then turn around, walk back to the chair, and sit down. The patient should wear their normal footwear and use any customary walking aids if needed. The time it takes to perform the test is measured and recorded. The clinical assistant will then complete the electronic health record or EHR intake process and notify the provider when the patient is ready to see them. The doctor will meet with the patient and perform the exam, which will include counseling on the advanced directive form. The results of the exam will be documented by the provider in the patient's EHR. If a SEARCH social worker is available, they will meet with the patient to address social determinants of health, providing community resources and services if the patient is interested. The annual wellness examination is then concluded. The annual wellness visit is an excellent opportunity for patients to connect with their medical home team. It's important for patients to understand their Medicare benefits and how SEARCH can help them get the most out of their coverage. The annual wellness visit provides an opportunity for care teams to connect with their patients to better ensure healthy outcomes. SEARCH is committed to working together to prioritize our patients' health and wellness.